Hi, good afternoon, student. Good afternoon, everybody. This is Professor Nuges. As I promised last time, every weekend you're gonna have a new class for your Nclex exam. You know that, right? So today, I'm excited to bring a new class to you on management of care. So let's start now, class. Let's start. Class, remember, do not forget to buy your book. Okay. The content I am going to teach you right now is in the book. Okay. Make sure you continue to buy your book. Thank you for those who already bought the book. Okay. Thank you very much. Let's start now, class. Let's start. So let's start now. All right, let's see. Class on management of care. As you know already, management of care is a very important content for your NCLEX exam. So management of care counts for 17 to 23% of your questions. That is the reason why you need to master this concept really well because it counts on to 17 to 23% of your questions. Okay. What included in management of care? Management of care focuses on the nurse role in managing and coordinating patient care, including delegation, prioritization, and leadership's responsibilities. Okay. Make sure you know the management of care content is very important. Okay. All right. Now we are going to go directly to the questions because we're gonna answer many questions today. Okay, we are going to start on question number 12. Okay, number 12. Let's see. Let's see. Number 12. All right. What is the best way for a nurse to maintain patient confidentiality when using an electronic health record? What is the best way? Let's see the first choice. Allowing coworkers to use their login credential. No, this is not the best choice because you cannot let coworkers use the login credential. That's not good. Second, B, logging off the system whenever leaving the computer unattended. This look like a good choice, okay? B, but we are going to continue to see other choices. C, keeping the computer screen visible to everyone. No, 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 no. You cannot leave the computer screen visible to everyone. That's the bad choice. Okay. D, sharing the EHR information with the patient family. No, you cannot share the information with the patient family without permission. Therefore, B is the answer. B is logging off the system whenever leaving the computer unattended. You have to log off from your computer, okay, when you finish uh, seeing the information of the patient. Log off of the computer, okay? The keyword for this question is logging off. Close your computer or log off, okay? All right. Let's see question number 13, guys. Which of the following patients should be prioritized first? Which patient you have to care first? Okay, this is a prioritization question. A, a patient with a headache with who need a PRN medication. No, headache is not really a prioritization prioritization task question. Okay, B, a patient scheduled for surgery who need to be transported to operating room. Okay, this one look like the answer, but let's continue. A patient with a new onset of confusion and agitation. Wow, this choice number C, part C, look like the best choice. Because they say a patient with a new onset of confusion and agitation. The fact that we have agitation in this question, you need to care, because when the patient is agitated, the patient can beat other patient, he can beat the nurses. So the patient is agitated. Okay, there is agitation. That's why this answer is the best choice to take. Okay, C is the answer. C is a patient with a new onset of confusion and agitation. This is the answer. C. All right, let's move on. Number 14. A nurse delegates the task of bathing a patient to a UAP. What is the nurse's responsibility after delegating the task? After the nurse finished doing the task, what the nurse responsibility? Okay, let's see. A, assume the task will be completed correctly. Let's see. Okay, it's not, I don't think which is the best choice. Let's continue. Supervise the UAP to ensure the task is completely properly. Wow, this is the choice. I think this is why? Because the answer of this question is in the question. Because this is a nurse delegate the task of bathing a patient to a UAP. The UAP is the keyword. Therefore, choice B says supervise the UAP to ensure the task is completed properly. That is the best choice ever. You have to take B as a choice. Supervise the UAP. We can see the other choice, but we know B is the choice. She said perform the task again to ensure it was done correctly. No, you cannot perform the task again. D say document that the task was delegated. No, 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 no. That's not important. B is the answer. Supervise the UAP to ensure the task is completely properly. All right. Number 14. Let's see number 15. What is the legal term for failing to provide the standard of care that result in harm to the patient? How we call when a doctor fails to do his job or her job, or a nurse? How you call that? Okay, let's see. A, negligence. We I believe you used to hear this term, negligence. Okay, I believe this is the choice. Part A or choice A is the choice, because negligence is the term we use for doctor, for a professional, nurses, even teacher. If you do something wrong by teaching your student, and then you pose a problem, you cause a problem to student, they will call negligence. For doctor, it's the same thing. For nurses, the same thing. Negligence. So choice A is the best choice. Negligence. Let's see the other choices. B, battery. No, that's not the choice. Defamation. Defamation. No, 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 no. That's not the choice. Assault. No, that's not assault. Therefore, is choice A. Choice A is the choice. Okay, negligence. All right. Let's see question 16. When is when is it appropriate for a nurse to share patient information without the patient's consent? When is possible to do that? Let's see. Choice A. When the patient family requests information. No, 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 no. The patient family can request information, but you cannot do that. Okay? Choice B. When discussing the case with other healthcare providers involved in the patient's care. Okay? Let's see. This choice look like the best choice, but let's continue. When a neighbor inquires about the patient condition. No. D. When a friend of the patient calls for an update. No, 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 no. The best choice is when discussing the case with other healthcare providers involved in the patient care. That is the best choice. Okay? That is the best choice. B is the answer when discussing the case with other healthcare providers involved in the patient care. Very good. All right. Let's move on for number 17. Number 17. Which of the following task is within the scope of practice for an LPN? What task you can give to LPN to do? Yeah, delegation question. Choice A, initiating blood transfusion therapy. No, that's not it. That's not the task of the LPN. B, performing an initial patient assessment. No, the LPN cannot do that. Nurse can do that. C, administering oral and subcutaneous medication. Yes, the the task for LPN including this task, you see, administering oral and subcutaneous medication. So some students used to ask what is subcutaneous. When the LPN can help the patient, for example, a little injection under the skin that called subcutaneous medication. That is the choice. C is the choice. C is the answer. Okay, administering oral and subcutaneous medication. Very good. Good job. So let's see 18. Which action demonstrates the nurse role as a patient advocate? Let's see. What shows that can show the nurse is defending the patient? I translate the question for you. Defending. They use the word advocate. Okay, that's fine. But you need to know what advocate means. Okay, so let's see. Part A, following all physician orders without question. No, you cannot do that, nurse. Nurse cannot follow the physician orders right now without question. No, 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 you cannot do that. B, ensuring that the patient voice is heard in, in the care planning process. Let's see. Let's continue to with the question, the answer to C. C, administering medication without the patient consent. No, you cannot do that. D, ignoring the patient wish if they are not in agreement with the care plan. No, therefore, B is the answer. B said ensuring that the patient voice is heard in the care planning process. You need to follow also what the patient says. Okay? All right. So, all right. The question, for example, A, following all physician order without question. No, you know you cannot do that. Okay? You cannot do that. Therefore, B is the answer. B is the answer. Very good. 19. Let's see. What should a nurse do if they are unsure about how to perform a task they are delegated? If you're not sure as nurses what to do, what you have to do, okay? What you can do. For example, they give you a task to do, but you don't know. So let's see. Part A, choice A, perform the task of the best of their ability. No, you cannot guess the task. You can kill the patient if you do that. No, make sure. B, ask for clarification or additional training before performing the task. This choice look like the best choice ever because they say ask for clarification. Anytime you do not understand anything, ask for clarification, okay, to know what to do. C, refuse to perform the task. C could be the answer, but no. Refuse, you need to ask question. D, delegate the task to another staff member. No, you cannot give the task to another task member to do. Therefore, B is the answer. Ask for clarification or additional training before performing the task. Perfect. 20. Let's see, it chose 20, the question 20. Question 20. In which situation it is acceptable for a nurse to, with patient confidentiality. What case the nurse can breach the confidentiality of the patient? What choice? Let's see when. First choice, when required by law to report certain condition, okay? That means communicable disease. This choice is very important. When required by law, this should look like right. Let's continue to see other choices. When the patient has disclosed the condition to others. No. See, when the patient has been rude to the healthcare staff, that doesn't make sense at all. D, when the patient is a public figure. No. What is the choice? The best choice is choice A, when required by law. If the law say you need to give the patient information, you have no choice. You have no choice. Okay? Because the law say that. Okay? The law say you need to give the information. Choice A is correct. Okay? Let's see 21. A patient with advanced directives state they do not want to be resuscitated if they stop breathing. Ha! A patient sign contract. Do not resuscitate the patient. Okay? The nurse observe the patient condition deteriorating. What should the nurse do? But remember the law. The law say the patient sign contract not to resuscitate him or her. So let's see what the nurse should do. A, begin resuscitation effort immediately. No. Remember, you cannot resuscitate the patient because the patient signed a contract. B, follow the patient advance directive and refrain from resuscitation. Choice B, look like right because remember the patient signed a contract. C, contact the physician for further orders. Not this choice. Not good. D, ignore the advance directives and perform life-saving measures. No, you cannot ignore what the patient signs. The patient signs a contract. Therefore, choice B is correct. Follow the patient's advance directive and refrain. Refrain means don't do that. Refrain from resuscitation. Okay? B is the correct choice. Okay? We are in question 21. B is the correct choice. Okay? Let's see question 22. What is the primary goal of the Health Insurance Portability and Accountability Act? What does that mean? What is the objective, the goal? A, to prevent insurance company from denying coverage. No, that's not the objective. B, to ensure that the patient information remain private and secure. This just look like right. Because anytime they tell you something right regarding the question, you should know. C, to allow healthcare providers to share patient information freely. No, that's not the choice. D, to increase the cost of healthcare. No, 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 no. The choice for this question is to ensure, the best choice, to ensure that the patient information remain private and secure. Perfect. Choice B is the best answer. Make sure you choose the choice B. 23, question 23. Today we're gonna stop on question 25. We're gonna stop on 25. What should a nurse do if they receive a potentially unsafe order from a physician? If the doctor gives you a bad order, okay, a dangerous order, what you gonna do as a nurse? Make sure you understand the question. So, first, refuse to carry out the order without further discussion. No, You need to have discussion. You cannot just refuse. B, follow the order as written. No, you cannot just follow the order. C, consult with the physician to clarify the order. Very good. That makes sense. It's about common sense, guys. Common sense. C, consult with the physician to clarify the order. Talk with the physician. Talk with the doctor before you execute the order. Okay? So C is correct. It's the best choice ever. C is the correct choice. 24. Which patient should be prioritized first during a mass causality situation? First of all, the keyword, what is a mass causality situation? Let me tell you, if you don't know what mass causality means, you will not be able to answer this question. Okay? So, what is this? A mass causality situation is when there is a big situation where the hospital is not enough to get all those people, to get all these patients. We call that a mass causality. For example, let's say there is a big shooting. Many people get shot. So, or the same as when there was COVID. Remember the situation? So now we call that mass causality situation. Okay? Make sure you remember the explanation of what is mass causality situation. Okay, let's see if there is something like that. Which patient you should be prioritized first? Let's see. First, a patient with a minor laceration on the arm. No, you don't need to care about this patient. It's very light something. Okay. B, a patient with head injury who is unresponsive. This just look like right. This should look like right. But let's continue to read the other choices to see if there's not, if there is a worse one. C, a patient with a fractured leg. No, fractured leg, you can resist. You're not gonna die. D, a patient with a potential spinal cord injury who is in severe pain, severe pain, severe pain. Make sure you get this keyword, severe pain. That means that is the best choice ever. Because remember, when the patient is in pain, very severe, the patient can be dead because severe pain. The patient can be dead. Therefore, that's the best choice. Some students can say, why you don't take unresponsive? Because head injury, unresponsive. You should take this choice. But no, a patient can be unresponsive, but it's not gonna be die. It's not gonna be dead. Okay? It can be responsive for like 5 minutes. Some other patient care, but this one, severe pain, whoa, trust me, he's going to be die. He's going to be dead soon. Take care of this patient. Injury who is in severe pain. D is the choice. D is the best answer. This question is tricky. Trust me, very tricky. You need to pay attention. Very tricky. They will give you this question in your exam, in your Nclex exam. Okay? Trust me. Last question, guys. Question number 25. A nurse is assigned to care for your patient. Which patient should the nurse assess first? Priority question. Yes. Which patient? A nurse is assigned to care for 4 patients. Which patient should the nurse assess first? A patient scheduled for discharge in the afternoon. No. B, a patient with stable vital sign who is receiving IV fluids. No, they already tell you it's stable. This patient is stable. C, a patient who is post-operative with no complication. No, Don't care about those patients. A patient who is newly admitted and experiencing chest pain. Wow, D is the answer. D is the answer. Because this patient just come to the hospital, then he experiencing or she chest pain. When you see a patient get a chest pain, make sure you care the patient first. Okay, make sure you know that. Mhm. They gave you the choice, the tricky choices, but you need to be able to see which choice is the best one. Okay, therefore, D is the best choice. Mhm. Thank you very much, guys. Thank you very much. I think, okay, this lesson today is a very huge lesson. You need to practice this lesson, listen to the video, see the keywords for all those questions. This lesson was on management of care, which is very important, guys. Okay, very important. You know that. Very important. So I can tell, thank you very much. Thank you very much. Thank you. Okay. Guys, do not forget to buy the book. Okay. All those questions are in the book. Okay. You can practice. You can get your own book right now. Buy it. Okay. Thank you very much. Thank you.